talk about how to properly transfer when you have back pain. I want to demonstrate kind of like the poor way to lie down, especially back problem. So most of the time, if we lie down, we would do this. We're gonna lie on our back and down like that. So in this moment, your body is bent. If you have back pain, that actually is very hard to do. So the same thing when you get off the bed, people do like this, they do like a little crunch and then they get up like that and trying to get up there. So that is actually very difficult to do and it strains the lower back. We have transfers that go from sitting to standing, and then we have transfers that go from sitting to lying down. So I will demonstrate how to properly do this. So if you can sit on the edge of the bed, and I want you to try to lie down on your side, we're gonna use your lower leg as a leverage weight to counterbalance our upper body. So basically, if you can, get closer to it. So my knee is close to the edge. And the moment I go down on this side, I'm gonna use my elbow to decelerate me. Okay, so there you go. I'm gonna go like that. You see from there, my body is relatively straight. Now from that point downward, you could roll on your back. So the easiest way to roll is to do a log roll. So if I straighten my bottom leg, if I push, then I ended up on my back. So if we do the reversal, if you want to get off on this side, I want you to see if you could bend up your leg. The leg that you're gonna roll towards, keep it straight, so like a log. So when I push with my stronger leg, keep my arms in, I tuck, I do a very quick way to roll. So the benefit of that is your spine is actually very straight. Now, when we are trying to get up there, we're gonna do the reversal of what we just did in lying down. So bring both your knees up towards your chest. My foot is very close to the edge of the bed. I'm gonna drop my leg off in a moment, but I want you to try to time it. So as you drop your legs, you're gonna push with the arm. You can push with the bottom arm, but also the top arm. Try to keep your body straight, and then using the leverage, here we go, push. So you can see the weight of my leg and my body just tilts. Now I would like to demonstrate how to get up from sitting to standing position. So in sitting, if we keep our bum and our back against the chair, that's usually how we rest our back. If we're trying to get up from this position and trying to get up like this, it is very, very hard. So what we would do is that if you can scoot your bum closer to the edge, so I'm gonna scoot right, left, to the point you feel like your sits bone is just right close to the edge of the chair. Then I want you to bend your feet in. So we talk about the center of mass is over your feet. We call the base of support. From this point forward, instead of getting straight up towards the sky, I want you to lean your body forward. I'm doing it slowly there. When you lean forward, so now the weight of your body is between your legs. From that point downward, if you push with your fingers and your hands, and you can push it off, going more forward, almost your chest is going towards the sky rather than going up to the sky. So in sitting down, we do the reversal. If you could back up till your back of your calf touches the chair, we usually would like you to take your hand. If there's a support, armrest or a chair, just try to reach down. So as I go down, you can see the front part of my body weight is over my toes. I'm gonna hold on to the chair and slowly sit down and then back. I would like to talk about proper body mechanics. This is more for your lower back. In most cases, we try to keep it neutral, which is straight. In nomenclature, when we bend forward, we call that a flexion. You can see my back is rounding. When we go backwards, that's what we call extension. When we do things, we try to keep our spine kind of straight. We call neutral. We do have a little natural curve that we call lordosis. Try to maintain that in your daily tasks. So in daily life, there are a few things that will actually cause a lot of stress to our lower back by doing flexion. For example, in the morning when you first wake up, if you wash your face, pretend that this is a sink. Do we bend down over here and wash our face? Same thing when you brush your teeth. When you brush it, do you bend over like that? So that is very tiring. If you have back problem, we could modify a bit. if you can, try to squat with your legs more, get your body closer. I know this might get a little trickier, but if we use one hand to support, then we could brush our teeth this way. My back is more vertical. If you have to lean forward to spit out or rinse, then you could just lean a bit instead of bending quite far. Same thing with washing face. I know it requires two hands, so you might have to do it like this, or wash it in the shower, or use a face cloth instead of bending right over the sink and wash it like that, which is very, very harsh. In this position, we also simulate washing dishes. So if the sink is particularly low, if we bend over to wash dishes, or vegetable, for cooking for that matter, then you are into that flexion again. So if you can, again, get closer and use your leg. And some people might actually open up the cabinet, put your 1 foot inside. So if I pretend that way, if my 1 foot is inside, you see my back naturally is a lot more straight, because now I could put the weight between my two legs to do it. The other thing I would like to talk about is how to properly put on pants, socks, and putting on shoes when you have back pain. So normally I think we put on pants in standing with one leg and put in one leg, then the other. However, if you have back pain, to do that is very difficult. So we could do that in sitting. If you have a chair with a back, I would prefer you lean your back against it. Then you take your pants, I want you to roll up the cuffs, obviously, and you could use the other leg as support. If you're able to reach it up and slip it through here, my back is close to the chair. If that is very difficult, then you're gonna have to go bend your leg up and slip it through, okay? And then go the other side that way and go through the other way. It seems like a pretty crazy motion to do, but it definitely is better when you have to bend forward like that. So the other thing I noticed is that when people put on their socks, same idea. If we go down to try to slip on the socks, your back is in a lot of flexion. That tend to cause a lot of pain. So we could do the same thing. Back against the chair, bring it up, roll up the sock, and go up this way, okay? They actually do sell a special tool that you could put the sock in a little plastic tube with the strap, so you could actually slip it in, if you choose that way. Now, same thing with the shoes. If we tend to put on the shoes, bend down to tie the shoelaces, again, your back is gonna be bent. So either we'll go back to the same idea of putting your back against it, slip on the shoes, tie it here, or maybe you actually do try shoes that you don't need to tie the shoelaces. So the last thing we'll talk about is lifting. You probably have heard this many, many times, but we will talk about it too. So when you bend, if you have to lift something, most people will bend over like this. You see your back is arched and trying to pick it up. That is very, very harsh on your back. So we try to keep our back straight and use your legs to squat down, get closer to the box, pick up and use your leg to lift up. When you turn, I want you to try to walk around with your legs, almost like you're a robot or a soldier, okay? So don't do a twist and then try to put it down. That is horrible.